Welcome, everyone. I was thinking this morning about a metaphor of yeast and how this, for issues related to shelter, is a yeasty time. There's a lot going on where we have resources coming from a variety of sources that we never would have expected to be available, and never more important for us to weigh in on how those resources can be used. There's a poem by the poet Judy Grahn who was relating to women, but I want to expand it to all of us. She said very shortly, "Woman is as common as a loaf of bread, and like a loaf of bread will rise." So that's my thought for us today too, is we are as common as a loaf of bread. The table at which we sit, the open table to which everyone's invited, we sit as this loaf of bread that will rise. And so I challenge us today to put our minds to the task. And I want to welcome everyone who may be new or returning after some time away. We use this time initially to make sure we're in touch with you and that you know that you're welcome. My name is on the agenda, and if anyone wants to know more about something, it's sometimes a little hard to figure out exactly how. You're welcome to contact. One is here though. We'd love to meet you. And if you're from an organization or presenting today, just to mention that, not a long introduction, but your name and whatever group or project you might be associated with. So if anyone is new, I invite you to let us know you're here. Just unmute yourself.
Hi, my name is Monique Brown. I've been here once before, not virtual, in person, but I am the executive director of Fob Hope, a nonprofit that does outreach for homeless veterans.
Well, welcome, Monique. We're happy to have you here. Thank you.
Hi, my name is Rebecca Cardy. I'm a public health nurse with the Tacoma-Pierce County Health Department, and I am going to be involved in one of the presentations this morning about substance use disorder treatment.
Well, welcome, Becca. We're happy to have you too.
That's the first meeting I have been able to attend, so I'm pretty excited.
Welcome.
I'm Jake. I'm also with Tacoma-Pierce County Health Department, and I'll be on the same presentation as Becca.
Well, welcome, Jake.
And
are you muted?
I am. I'm Kelly Triggs. I'm also part of the Meds First program. I used to attend the in-person coalition meetings when they were just up the street from us, but this is my first Zoom meeting.
Well, welcome, Kelly.
Thank you, Rob, for all your help.
Great. All right, if anyone else is new or would like to put your name in the chat for anybody to contact you for any particular outreach that you're doing, please do that. And we welcome everyone today, and I'll turn it back to Rob.
Thank you, Rosemary, and welcome everybody who's joining us for the first time. At this point in the meeting, we will shift over to our weekly This Week on the Streets section. This is an opportunity for folks who are doing direct outreach or interacting with those who are currently living outdoors to offer what they've seen change this week, what needs that have been identified this week that other coalition members might be able to address. So I open the floor, see if anybody has anything to update us this week. And feel free to just unmute yourself and share with us.
I was not able to get out much this last week, having finished the last of Holy Week, but I did see quite a few camps with garbage bags and garbage piled up in garbage bags. And we know the city is picking those up. So we do have some progress happening out there.
Thank you, Jeffrey.
I spent a good part of the week visiting Paula's little caravan of showers and laundry machines, and was much easier to reach clients in that environment. They were coming for one service and then I can also see them. So that was really great. And the other thing I did yesterday was went out to see the places where the city is thinking of putting camps. And they were far from services. Both had reasonable views of Mount Rainier, and the one on 35th and Madison, I think, is an outstanding view of Mount Rainier. I mean, I'd pitch by 10th there, but I don't know how you get to the doctor. I couldn't easily see bus sites. It was just, you know, kind of nice to get rid of them, but isolating. And the next place down on 69th and Proctor was even more isolation. That no grocery store, that was easy walking. You know, just really horrific to think of having people stay there, and you wonder how long they would stay there. So anyway, that's my spiel for the day.
Thank you, Marilyn. And just for folks who may not be familiar and don't attend every week, Paula that you were referring to, Marilyn, is Paula Anderson out in the Puyallup area. So just for that context. Thank you for that. Others? Okay, so if there are other updates that folks would like to share, please drop those in the chat. As a reminder, anything that was put in the chat becomes kind of a resource for us to look back on because we maintain and keep those chat files. So if you put things in there and post them to everyone, it gives us kind of a an outward brain of the whole coalition. So please do so if you have information that you think is important to share with everyone. And why don't we shift to our first presentation? So Becca and Jake from the Meds First program. Jake, let me make you a co-host so that you can share your slide deck and we can go ahead and move on to that portion of the meeting. There you go, Jake. You should be a co-host now so that you can share that part of the presentation.
Thank you.
Yeah.
Cool. Are we all up?
I can see it.
Great. So we are Meds First Tacoma. We're here to help. So our agenda for the presentation is we're going to talk a little bit about the services that we provide, and then a little bit more about what we do exactly. And then we provide resource navigation for all of our clients who are engaged with us. So we're going to go a little into what that looks like. We're funded through a research grant, and that allows us to be a lot more flexible than some other agencies have the ability to do. So we're going to talk a little bit about what our research grant looks like and the research that we're doing. And then we're going to discuss the ways that we are providing low barrier treatment, and then some of the things that we don't have a lot of negotiation with and can sort of get in people's way. And then lastly, our nurse is going to talk about medication assisted treatment and what the medicine we prescribe is doing. So an overview. We are a low barrier Suboxone clinic. We receive funding through the University of Washington. We have a research grant that allows us to be able to provide no-cost service to people and do it on a walk-in basis. We pride ourselves on being an entry point for those seeking treatment. A lot of people that we see are people who are experiencing homelessness or people who are really scared to go to like their primary care about their opioid use disorder. And so we try to make it as easy as possible to come in and get out with your first prescription. And then lastly, we are a 6-month program. So our goal is really to help people get stable in their recovery and get them set up with a long-term provider that can manage their care for as long as they want to be on this medicine. So that's sort of where we go. We really plan to prepare clients to get connected with our community partners. We have a lot of clinics that we refer to, and we like to talk to clients about what their options are, where they're located, what some of their barriers are, and what it is about those clinics that are going to be beneficial to them so that they can have a most informed choice when they decide where they want to go after our 6 months are done. We provide treatment for opioid use disorder with medication-assisted treatment. And so we do that with medication management and medication counseling. Our nursing staff talks to clients about what the medicine does, how to use it, how best to use it to meet their needs, and then they troubleshoot anything that comes up. And then lastly, we provide resource navigation for a holistic approach to client care. So what resource navigation looks like is it's very much like a case management approach. Everyone gets assigned a client care navigator who connects them with resources like Medicaid, food, employment, transportation. We try to connect them with housing. If they're interested in mental health care, we can help them get connected with a provider in their area. Same with primary care. When people are getting ready to get back into the swing of things, going to medical appointments, we can help them find a provider that's going to be beneficial for them in their area. We can go with them on their first appointment to make it an easy transition for them. We also help with things like SSDI to help people start that process because it can be kind of scary to take those first steps. And then all of our resource navigators are very client-centered. We have a focus on harm reduction and empowerment. So we talk to our clients about what they think they need at this moment, and then we work from where they're at. And then I've talked about the research grant a little bit already, but the University of Washington provides Meds First funding to study the efficacy of low barrier access to medication-assisted treatment. And so what that means is we have a walk-in clinic and we want to make it as easy as possible for clients to get started on Suboxone. So resource engagement isn't mandatory to receive treatment. Just because you are getting a prescription from us doesn't mean you're engaged in the treatment, but we do give clients the opportunity to engage. It's really easy to be a part of the treatment. We're doing a longitudinal study. So they're looking at their health record from 6 years back to 6 years in the future after engaging in services with us. And they're looking for hospitalizations, inpatient visits, things like that. And then if they are interested in listening to us talk about the research, they are able to get a $20 gift card, which is a pretty big deal for a lot of the clients that we serve. And then what's cool is since we're research or grant funded, we don't have to bill for services. So everything we do at this moment is provided for free. So it makes it really easy for clients to come in here knowing that they're not going to get a huge bill for their first visit. We can set them up with insurance and help them get connected with anything that's going to make their recovery easier. So that can look like paying for their first prescription if their insurance isn't going to start until a few days after. So we can sort of get them in that really strong motivation period. And then what low barrier looks like to us, the way that we've set it up is we have a walk-in clinic. We figured that would be easiest for a lot of the people that we serve. We see people Monday, Tuesday, Wednesday, and Friday from 11 a.m. to 3:30 p.m. And that is specific for if they want to come in and get a prescription. If they have a resource navigator that they're working with, we can be a little bit more flexible, but this is when we have a provider. And then for anyone who's new, we have to be a little bit stricter about that because intakes take a little bit longer, but we can see people from 11 a.m. to 2 p.m. And then new intake appointments usually take about an hour, 45 minutes to an hour, depending on the client. And we try to do them as quickly and succinctly as possible because a lot of times when people are coming in for their intake, they're not feeling very well. And they really appreciate when we're able to try to do things quickly. Some other things that we do are folks never need to schedule an appointment with us because we are walk-in based. That is going to go for their entire 6 months. But we do try to get them to come in sort of regularly at a regular time, just because it helps with the continuity of their care if they're coming in once a week, sort of around the same time. And then that helps them practice for when they go to a primary care and they don't have that same level of flexibility that we can offer. One of the biggest things that makes our clinic different than other clinics is we do not discharge people for concurrent use. So many of the clients that we see are coming in maybe from being homeless or from experiencing co-occurring use. So maybe they're using methamphetamine or cocaine while they're trying to get a hold of the struggles that they're having with opioids. And so it's really easy for clients to be able to work on one thing at a time instead of expecting them to be sober from everything. And finally, we strive to be as flexible as possible for clients' needs. All of us have a lot of experience working with this population, so we've all sort of pitched in to do little different things to make it easier for clients to come in. Like we have a pantry for clients who are experiencing food scarcity. We have a clothing closet full of coats and shoes for clients who might need something when it gets cold out. We have secured sleeping mats for clients who are sleeping on the streets that are easy to dry out and are light and that they can take with them. So we've really put a lot of thought into trying to make this as easy as possible for clients. And while we've put so much effort into making it low barrier, it isn't no barrier. So we do require an ID. It doesn't have to be a state issued ID. It can be a paper copy of an ID. It can be a jail ID when they're getting released. It could be a hospital wristband. Really, the reason why we need an ID is so that we can ensure that they're going to get their first prescription from the pharmacy. The biggest thing that gets in the way of some clients is they can't have been engaged with medication and assisted treatment for opioid use disorder within the last 30 days. So if they're coming from us from a methadone clinic or another Suboxone clinic, and their last prescription was 2 weeks ago, we would have to say, hey, we can't see you. If you can't find anyone, you can come back at the end of 30 days. But that is really for our grant and to make sure that we can continue to give the services that we're doing. We do random UAs. A lot of people get kind of nervous with the idea of UAs. So we do a full panel on the first intake, and that's a diagnostic UA. And then after that, we only check for Suboxone to make sure that they're taking their prescriptions as they say they are. And then we're pretty upfront about that, and we let them know that this is sort of what we're doing and that this is a reporting requirement to be able to do so many UAs in the time that you're with us. And because we see clients on a first come, first served basis and we don't do appointments, it can get kind of tricky for some clients who have a little bit more of a strict schedule. When people get jobs and they can only come in a very strict window, we try to be as flexible as possible with that, but we can't always guarantee that they're going to be seen right then. So usually when that happens, we start to talk to them about finding a different clinic that has more flexible hours or might have Saturday hours, and then we sort of go from there. And lastly, the thing that can get in the way for some people is we will never prescribe more than 2 weeks at a time. We only have 6 months with people, and so we find it really important to be able to see them and have touch base with them as often as possible as we're sort of guiding along with their recovery towards finding a long-term provider. So one of the things that we do that actually makes it a lot easier and a lot more beneficial for some people to go to their PCP is talk to them about how they are able to prescribe for a month at a time or a month with a refill. And so it makes it a lot easier for that transition. And then we're going to go into the medication assisted treatment part of this, and I will give it away to our supervisor and nurse, Becca.
Thanks, Jake. And I'll just leave you with the control of it, and I'll ask you to switch when I'm ready. So yes, like I said, my name is Becca. I am the supervisor for this Suboxone clinic at the health department. I have been, I guess, just as a little tiny bit of background for myself, I came into this work from close to a decade in the emergency department. So it's a very big change of pace for me, but it is incredible work that we're doing here. This is probably one of the most fulfilling jobs I will ever have. So predominantly our patient population is either completely homeless, sleeping on sidewalks, or incredibly unstably housed. It is a very, very, very small part of our population that has stable housing, even people who have like a couch that they can regularly sleep on. So that is, as you are all aware, working with our homeless community, a huge barrier all on its own to any kind of stability for anything. So we're aware when our patients walk in, we're asking them to do something incredibly difficult. We're asking them to, most of them, to be homeless and also to be sober. And that's a big ask. So just as a baseline, the medication that we provide is Suboxone. We are right next door to both the Tacoma Needle Exchange and to the methadone clinic that's at the health department as well. And we encourage all of our patients to go to the needle exchange for everything from clean rigs and setups to Narcan. If we don't have any, we try to keep a pretty solid supply of Narcan on hand so we can hand that out to everybody. We try to get everybody to take it, even if they say they don't need it, because you can hand it to anybody else. It's like totally safe to do that. So methadone and Suboxone, those are the only two medications to treat substance use disorder that actually are opioids themselves. So both of these medications, what they do is they take the place of heroin, oxycodone, fentanyl, whatever it is in the brain. They occupy those receptors. They prevent you from going into withdrawal. And they also prevent you from having that very intense psychological need to just like go find, go find, go find. So you can have your day to think clearly and do something like go to your child's parent-teacher conference, or try to find a job, or try to reestablish a relationship with your family. Sometimes it's just the really basic things. There are a few slight differences between these two medications. Methadone, you can overdose on if you take too much, so that is pretty strictly controlled. It comes in one single form. It is only a liquid. There are only two places that you can get it. You can go to, well, that's not exactly true, I suppose. You can sometimes get it prescribed in a tablet form from your doctor, but it is mostly you either get it from a methadone clinic or you can get it as an inpatient in the hospital. If you are using whatever your opioid of choice is, and then you use methadone on top of it, again, you can overdose. You also will not go into withdrawal. You can transition seamlessly from one to the other and have no problem. Suboxone is slightly different. It is an opioid, but on a minute chemical level, they're just enough different that if you are using heroin, oxycodone, whatever your drug of choice is, and then you take Suboxone, it will make you go into withdrawal. You'll feel really bad. It'll last for a long time, 8 to 12 hours, maybe longer. And then you would be scared of it and never want to try it again. So we have a few different ways that we can have people start this medication. Either we ask them to go some ways into withdrawal. Generally, it's between 12 to 18 hours without any use. And then you take a small amount, make sure you're not going to get sick from it, and then build up to your dose. You cannot overdose on Suboxone unless you're like a 2-year-old child. It has what's called a ceiling effect. Above a certain amount, it doesn't do anything else. You can take all you want, it will do nothing. There is a way to start Suboxone without going into withdrawal, but you have to have a supply with you of whatever your drug is. And then you sort of build one up really slowly and taper the other down really slowly over a couple of days. So the most straightforward way is you go into some withdrawal. But for our patients who are using a lot of fentanyl, that stays in the body for a really long time, and you have to go into withdrawal for much longer than just 12 or 18 hours. It can be a couple of days sometimes before you're able to start Suboxone comfortably. With this taper method, we can do it over a couple of days. Everybody feels like we have pretty good feedback on that. Everyone feels generally pretty comfortable with that transition. But you have to be like you have to be able to follow some slightly more complicated medical instructions for that one. And then Vivitrol is, a lot of people think that it sounds kind of like the silver bullet because it's a monthly injection. And you can't, if you use while you are on Vivitrol, nothing happens. It's basically like a very long acting Narcan. It just blocks the receptors completely and nothing can get in there. But you do have to be in withdrawal, no use at all, for a little more than 7 days. And you can't, you can do it from home. Sometimes you do it in inpatient. It's a little bit variable, but it doesn't do anything at all to help protect against withdrawals. So you just feel really crummy and you can't use, and it has a very low retention rate. The success rate of Vivitrol is similar to the success rate of Narcotics Anonymous. They're both about 9% success rate. Suboxone and methadone, they are similar. It's like 16 and 17 or 16 and 18% long-term success rate for abstinence. So that's a relatively basic medical overview. And the medication, again, that we prescribe is the Suboxone. It does have a few different formulations. The one that we prescribe is strictly a sublingual one. So it goes under the tongue, it dissolves, it takes several minutes to do so, but some of the clinics that we refer to, they're able to do monthly injections, similar to the Vivitrol, but much less painful, and they provide, the injectable Suboxone still provides that protection against withdrawals. You want to go to the next slide, Jake? Sorry, just one moment. All right, so Suboxone is the name brand for the buprenorphine naloxone. The combination product is the one that we prescribe. Straight buprenorphine, that's the actual active ingredient, that's the opioid itself. You can only prescribe buprenorphine to someone who is using and pregnant, or they use it in pain management clinics. But there's no like FDA approval for using just the buprenorphine to treat substance use disorder except for in pregnancy. The naloxone component, which is Narcan, that's the generic name for Narcan, that is there strictly to prevent people from melting it down and injecting it, which is not necessarily dangerous because, again, you can't overdose, but that's probably the only way that you could really get much of like a high type feeling on it. We did have someone in the health department who was going into withdrawal and they didn't have an ID. We couldn't get them in that day. And they had their partner's Suboxone and they melted it down and injected it in the bathroom and they sent themselves into withdrawal because of the Narcan and they thought they were overdosing and it was really scary for them. So, you know, that has happened. So Suboxone is newer than methadone, but it is a very well-researched medication. We do know that it works really, really well. And it just depends on the person for which one is going to work better. So there's very, very strong evidence to support both methadone and Suboxone as life-saving medications and Narcan all on its own. I guess another important thing to note about Suboxone, because of some of those tiny chemical differences, if someone does use while they're taking Suboxone, it blocks their receptor. It sticks to the receptor really, really, really hard. And so you're not going to get high. You can't get any heroin or oxycodone or fentanyl or anything into your brain where it needs to get to give you that high feeling if you have Suboxone in your system. So it's also, if people are using, going to give them maybe one of the first like immediate negative feedbacks to using. You can go ahead and go to the next one, Jake. Thanks. So, any questions? I know that was a lot of medical stuff, but it's hard to get through explaining the medication without going into some of the chemistry, biochemistry of it. But any questions from anybody?
So Jacob, a couple of questions. One, there's a request if you could drop the slides into our chat so that people could have access to those. And then also, if you could stop sharing your screen while we take questions and everybody can be seen, that'd be great. All right, so we're open to any questions if you want to raise your hand or speak up. If something has been dropped in the chat that hasn't been addressed, please bring it forward now.
I guess maybe just as a point of interest for everybody, our team right now is 2 nurses. So there's me, we have another nurse, Hannah, and then we have 3 care navigators at the moment. And with that, we are very easily able to manage a patient load of at least 100. We're not there right now. We have definitely some space and availability, but Teresa, do you?
Hey, so I have a question just about people who are under DOC supervision. Do you work with anybody who is under DOC supervision?
Yes. And that, so the only issue that we have run into there is sometimes DOC requires witnessed UAs for their substance use disorder treatment. And we do not do witnessed UAs. Like Jake was saying, we use them partly so that we can make sure we're meeting like federal guidelines and federal requirements. And yes, we can do this presentation for anyone's organization who would like. We'd be happy to. And then we also, like Jake said, we use it because we do want to be good stewards of the medication, and we want to make sure that we're actually helping people get to their goal if their goal is to be sober. So we do some drug screens occasionally to see if they're taking their buprenorphine, and if they're not, it's not like, all right, that's it, you're out of the program. It's like, this is a conversation that we really have to have. If you're trading it for heroin or if you're selling it, like, what is it? Is there anything that we can do to help you stop doing that? But yeah, we have actually, right at this moment, we have a couple people who were sent to us by their PO, which is pretty cool. We're glad that they're working with us. Elisa Solberg, she's our program director. She has been in contact and communication with some of the judges in Tacoma, trying to get us on their radar and make them feel a little bit more comfortable working with a clinic similar to ours, where everything is a little more relaxed.
All right, so any other questions for our guests? Well, I'm not seeing any. If anybody, oh, here, Maureen's asking if you can go out with homeless outreach teams.
We have talked about that a lot. We kind of go back and forth on it. Some of the people on our team have, actually, I think all of the navigators on the team have experience going out into the camps and doing actual like homeless outreach out into the world for all kinds of reasons. Right now, our biggest restriction there would just be, we have clinic 4 days a week. And I think safe injection sites are an amazing idea. I think it's ridiculous that people don't want them there, but can't argue too much and they stop listening to you. So, but no, every time a safe injection site has ever come up on any ballot, I have always called and argued firmly in its favor. We would love to do outreach. Right now, it's more just a kind of matter of time, and the health department sometimes gets a little bit weird about staff going out into the world. So we'll see. We'll just keep working on them. And if you already have a group that's going out there, they might be, like the higher levels of administration might be more comfortable with us going out with another group that's already established.
I come from a background of being solely outreach and going into encampments. So I kind of continue to do that on my nights and weekends. Not part of my job, just concerned about my community and the effects that it has on the community. I drop off anything I might have that can help them. I don't give them money. But it would be so much better if we went in teams during the day for safety reasons and other reasons. But it's outreach is why I'm here. I want to do the outreach. I want to get out there and let the community know that we're here.
And to clarify about outreach, right now we're not set up to be able to induct people in camps, if that's what you guys were getting at. So we have the potential to go out and meet with people and talk to them about what we do and let them know that we're here. But at this time, we wouldn't be able to do a full induction and get them set up with their medication while they're in their camp.
But we can certainly help with other needs they might have, other than induction, once we get out there. So,
Thank you. So I'll ask one last question, and then if others have questions, please feel free to drop them in the chat while folks are here. My question is, what's the most effective way for people who are doing outreach to refer into the program? Just to share some context, I know Garrett and I were on a call yesterday with the Pierce County Shelter Providers Group, and they were talking about the number of people who have died from overdoses since COVID began, with 4 folks being identified in the Puyallup area that had overdosed in the last year, and 21 that Tacoma Rescue Mission does outreach to, who'd passed away in the last year because of overdose. So what's the most effective way to refer people into your program?
I also, sorry, Becca, I also just put that question to the team about adding a slide to the presentation listing all the contact numbers, the location, the hours, so that it's all in one neat little slide.
And people can just walk up. Most people know where the needle exchange is located.
Got it.
And they can either come up and ask the needle exchange. If they don't see us, we're pretty close. We work pretty closely with them. And then we also have a very swanky high-tech setup of a tent with a table under it and a doorbell, and they come up and ring the doorbell, and one of us comes out and is like, hey, welcome.
And then if people are doing referrals to us, like they're going to bring people from camps or from the mission over to us, it would be easiest if they did it around like 11 o'clock, just because it takes a little bit of time to be able to do an intake. Like I said, it usually is about 45 minutes to an hour for the first session. And then after that, it gets down to about 20 minutes. So it's a lot easier if they get here a little bit earlier so that we have a lot more time to meet with everyone that comes.
Great.
Currently, it's a lot of word of mouth. Word spreads very quickly on the streets in this community, who helps and who is the best place to go to get the best care. They talk about us in the encampments, on the streets, everywhere. A lot of our referrals actually are word of mouth currently.
Great, thank you very much. And thank you, Jake, for dropping the presentation in the chat. And thank you again for your time this morning. Again, if anybody has additional questions, please drop them in the chat and we will move on to our next topic in the agenda. So thank you very much.
Thank you very much for having us.
Yeah, thank you so much for having us.
So Garrett, you're next up with a report on the activities of the ad hoc committee.
Awesome. Thank you, Rob. Last week, our other representative presented, Courtney, and this week is my turn. We had our third of 4 meetings, which is the ad hoc committee put together by Pierce County Council in order to basically get 2 more groups going. So there's 2 projects basically that are coming out of the ad hoc committee. The group that is going to create the comprehensive plan to end homelessness. All right, it's going to use the great work the COC did on their 5-year plan and take that to really end homelessness. And then the second group is going to work on the November 1st a goal to end all street homelessness in Pierce County. The county's done a nice job of keeping all the information in one place. I just put the link to that there. This week, we started off talking about kind of an overarching idea or approach to the comprehensive plan. I'm going to talk about that first, right? So again, the plan, the work is to create the group that puts this comprehensive plan together. And the comprehensive plan has a pathway to when, if we do what the plan says, we'll be able to eliminate homelessness in Pierce County or get to functional zero, right? Somebody becomes homeless, they've got a shelter to stay in and a permanent housing intervention to help them exit homelessness. The idea was brought up by Courtney, wish she was here to describe it, is called targeted universalism. And the notion behind that is that there's a universal goal. In this case, the universal goal is permanent housing for everybody. The targeted part is that to reach that goal, different people need different pathways. And the targeted part is saying that particular populations need to have approaches that are designed just for them, right? So our youth populations have a different set of needs than our veteran populations do. People that are immigrants to the country perhaps have a different set of needs than our Black neighbors that are experiencing homelessness and the systemic racism that drives that. So looking at each group and building programs that address the needs of each group while trying to bring everybody up to the goal of ending homelessness. So it's a neat framework to think about because again, we've got the same goal for everybody, permanent housing, just some groups need a tailored approach. And I'm also putting in the chat some information. There's a great video and some other reading about targeted universalism. And so that's kind of anchoring our strategy. And we have a very short turnaround on this work. It's I think 5 or 6 months for that comprehensive plan to get put together. So we're still talking about how to structure, you know, the group that's sort of the core group driving that. Is there a single core group of 10 people like there is on the ad hoc committee? Is it larger so that we can incorporate a lot more voices, although that can slow down decision making? But right now the plan is looking at about a 1 month period where the core group's going to spend the whole 6 months with it, but the core group's work in that month or 6 weeks is really to create the universal goal of ending homelessness and basically generally how we would get there. And then the next like 2 or 3 months is going to be all community outreach, like huge amount, going to all the different populations and saying, okay, this is the goal. Is this your goal? And how would we get the people that you know best to that goal, right? So collecting all this information, bringing all that back, and then creating the plan with all of that input of each particular targeted group. And then again, shopping that out for final feedback, right? But really having those lived experience voices driving that. And so that's kind of where we are, is working through a lot of those elements. And let's see, I got to read my notes really quick. And yeah, so that's the comprehensive plan. I'm going to circle back to that, but I'm going to talk a little bit about the shelter plan. So the other large goal that the ad hoc committee is charged with is how do we get everybody access to safe shelter, a safe place by November 1st. And we're a little less clear on how to do that, but we think that core team is going to look a lot different. So it's going to be a separate team. There may be people on both the comprehensive plan team and the shelter team, but it's going to be a separate team, and it's going to be much more drawing from outreach workers, shelter operators, shelter staff. And the first group obviously is going to be working hard to bring people with lived experience in, but on the shelter side, it's vital. And James can even chime in a bit on some of the challenges to really bringing that group into the conversation in a way that doesn't increase their trauma by setting up, false expectations and things, but really, heavily driven by the actual needs of people, not what we think would make convenient shelters to operate. Not that we do that, but it's easy to build the wrong thing if we're not super engaged in that. So that's where that is. We are having a meeting on Monday, this coming Monday at 8 p.m. It's going to be sort of a special, it's going to be a special steering committee meeting to kind of answer some questions. And the coalition website has information about kind of what we're looking at, but you know, there's just a number of questions we need answered. So that's a great time. And that's going to be before our final ad hoc committee meeting. So that's sort of our last chance to kind of discuss and come up with a coalition kind of policy on a number of areas. Like one area in the plan is, should we be including enforcement of, you know, no camping rules as part of what we do? And should we, you know, should the shelter plan include some permanent housing elements? Like, you know, how do we want as a coalition to be pushing that work? So that's a great chance for you to provide some input. I know I've talked a little bit long. I had one question. How does the committee view and consider those who view and treat homelessness as a commodity? How does the committee view and consider those who view and treat homelessness as a commodity? Kimberly, can you describe that question a little better to me?
Yeah, you know, and it's sad, it's a sad fact, but there are people that consider it as a way to make money. And so how do we combat that?
Interesting question. That's typically looked at among this group of people that make their living doing homelessness as a little bit of an insensitive question. For the most part, I don't think that people in the homeless system are making money off the homeless system. I'd be happy to have that chat offline. So that's not necessarily, yeah, I'm not sure how to respond to that, except to say that, you know, the paying social services and the agencies are not making ridiculous sums of money. The homeless industrial complex is not a true narrative in any way that I've seen. So that's not been any part of our discussions.
Yeah, I think that you misunderstood. That's not what I meant, but forgive me.
So, question, Dr. Ratcliffe?
I looked in the chat and I don't see the reference that you mentioned to the targeting. Is that, it doesn't seem to be part of the county website. Did you have
Boom, sorry, totally pasted the same thing twice. There we go. Thanks, Al.
Okay.
Presenting and pasting in chat at the same time is apparently more than I can do.
A difficult skill.
And there's a great little video on there, totally worth watching, about targeted universalism. So again, there's a great chance to provide feedback before the last ad hoc committee meeting by connecting in at that Monday night meeting at 8 p.m. You can also send emails to me. You can send them to Maureen. You can send them to Courtney. You can send them to James Pogue. You can send them to Lamont Green. Those are all people that are representing either the coalition or the continuum of care on that committee. And I'll put my contact information in the chat. Any other questions?
Yeah, Garrett, I have a question.
Yeah.
So we obviously know there's not enough housing. So what is the plan to move people? I mean, what is your thought behind moving people from the street to house? Is that encampments? Is that shelters? Is that hotels? And then the other question is it like this onesie, twosie, oh, here, I'm going to take you two people and put you over here and one over here? Are we trying to move the homeless community that has made themselves a resource for one another and move them together?
I think the goal is using all available resources, just like you said, right? It's going to be a challenge. So, for some people, continuing with a tent is the most appropriate place for them, right? And shelter until they can get permanent housing. But we'd love to see hotels and tiny houses and all of that. I would love to see communities moving as a whole as well. I mean, as much as we're capable, right? We want this to be what folks want, right? So yeah, we're limited by the world we live in, but we're definitely going to be driving those ideas. And that's the core of bringing lived experience voice in, is because we know we hear that a lot, right? People fail in permanent housing because we move them away from their social structures, right? And like that's something we do as a homeless system. And again, there's reasons we do it. It's not because we're insensitive to it, but yeah, being really intentional about trying to make permanent housing successful, right, has to do with continuing that community. And that's been an objective of the coalition for a long time. So,
And then
Maureen,
one
I
last
see your hand up.
question.
Oh, go ahead.
I'm sorry, Rob.
No problem.
One last question. Are we including the Washington State Department of Veterans Affairs in these conversations, or the VA, so we can tap into those veterans resources?
We have not explicitly talked about that, but the work around ending veteran homelessness that was put on hiatus when COVID-19 happened had all of those people at the table. And as we work on that special population, right, targeted universalism, as we work on that targeted group, definitely your group and all, all of the, the SSVF team at Catholic Community Services, that's, it's a housing program, VA funded, all of those groups have to be at the table. Everybody's got to be in and doing not just what they're doing now, but doing more. And so we've got to figure out how to get more resources for all of the groups doing what they're doing now and bringing new groups in, right, that need to serve populations that we do a poor job of. Immigrant populations are a great example. Like I don't think we have incredibly safe feeling homeless service providers for a lot of the, Latinx, Hispanic communities. It would be great to get more providers in there. Like those are some of our objectives, is, expanding it so that it's the right providers. That makes sense. I mean, again, I'm talking about what we hope to do and what we plan to do. Like reality on the ground might be different, but those are definitely our aspirations.
Yes, thank you. Appreciate it.
Maureen.
Just to frame the resource end, our world is different. So don't let whatever resource constraints led up to today stop you from believing things can be different tomorrow. County executive just put almost $69 million of only the county's ARPA relief money for homelessness and housing. So, and that's only the first pot of money we're seeing. So just don't let resources be your constraint. We may not get enough, but let me tell you, we've got so much more than we ever imagined.
All right, y'all know how to get a hold of me, but I'll throw my contact information in chat. Thanks.
Thank you, Garrett. And the next item the next two items actually on our agenda are related to the work that's been being done by teams related to the coalition structure. So I will hand the keys over to Rosemary and Kevin to talk about group meeting norms.
So Kevin, do you want me to start with this?
Yeah, I'm gonna, Rob, can you share the norms, or do you want me to or give me sharing power and I'll pop them up there?
I can share the norms here. Let me work on that while you guys start talking.
Okay.
So some of you've seen some of this before, and we've had a few iterations of it. But the idea is to both have some sense of, when you're in this group with us, what are our expectations of one another, both in terms of our attitudes and our aspirations and in terms of our behaviors. So Zoom itself provides some norms that we reinforce generally as we go along, muting and using Zoom's hand feature and limiting distractions. So turning off your camera when you're doing something else. The ones that are more important for our conversation, though, are the second set, and we've added, there's one that is not there. This is not the right version. I'm sorry, it's supposed to have a different one at the first. Okay, there we are. So if you look at the community norms after the Zoom norms, the first two especially, or even the first three, it's not always clear what exact behavior is being expected from the norm. but it's a norm that if we take it seriously, our behavior will follow. So we also, this is a summary of what's a lot more explained on the feature on the website. But this is what, if we agree to it today, we would post in the chat every meeting a couple of times to remind ourselves to lead with a racial equity lens, which is a challenge in the work everywhere in our country right now, and something we need to really focus on. To be aware of power dynamics, challenge concepts, not people, listen to learn, and then ones that are obviously something we could count, one person speaking at a time, speaking from our own experience, making space and taking space. So making sure we have 60 some people, how do we make sure people are able to be included, assume best intentions, and be aware of time and agenda. So this is an orientation to our conversation with each other, and we're putting it forward as something to approve today, if possible. And Kevin, I'll let you add anything you'd like to that.
Yeah, thank you, Rosemary. And I would just add just a little more on, Rosemary alluded to this, but this would be what would be shared in the meetings, particularly when we're on Zoom, as a reminder, and they're fleshed out in a longer document which would live on the website. So people can refer back to that a little bit more about what does it mean to be aware of power dynamics. Make space, take space, fleshing out that's, if you're someone who shares a lot, step back. And if you're not someone who shares a lot, step forward. And so we'd have some fleshing out of that, but this would be a quick reminder for our regular meetings.
So are there any questions or reactions?
Is there any way to set this up so that when we sign in, it just automatically pops up to remind us?
Would imagine I'd have to check with the tech people that maybe it could be something that would be added to when you register for the meeting. It comes with the link that you click on to join. And I don't know if Garrett or Rob, that's really possible, or if I'm just thinking it is because I'm not techie.
I believe that is possible. The other thing that can be done is I can share this document at least periodically as we send out the agendas, so that folks who receive that email on the list would be aware of the expectations for meetings. So any other thoughts or comments, concerns?
Maybe just by a show of hands, or Janet's already got her thumbs up, as does Teresa, if folks are in agreement with this. I guess more importantly, if you really are not in agreement with this, if you could let us know, and we'll assume silence is consent. All right.
Well, it looks like people are willing to go with this. And again, it's something we can keep working on so that we're making sure our open table really is an inclusive one. So thanks for your listening.
I want to add thanks to Dana and God, I'm going to forget who the other people are who were part of this conversation, but appreciate the folks who worked on this.
Megan and Teresa.
Yeah.
Thank you all.
Yeah, thanks for the work on this. And Brian, thanks for dropping that that link into the chat. I will take a look at that, and like Rosemary said, we can always revisit and add and improve. So appreciate that very much. So the next item on our agenda is also important coalition business. And I see that Garrett has put it on screen, and this is related to how the coalition determines who should be a representative to other organizations or in certain meetings. So I'm unsure who is going to lead this conversation.
I think it's me.
Okay.
So Yeah, more governance stuff, which is not nearly as exciting as the health department presentation, but here we are. We talked about this last week, a little bit, or 2 weeks ago, and really basically the process to pick someone to represent us. And we're talking about things like the continuum of care, right? We currently have an opening on the continuum of care set aside for a coalition member, and we need to fill that, right? So our process to fill that is going to follow this if we all approve this today, which is basically we're voting on it at a coalition meeting, right? I mean, there's some lead up things, right? We bring it to the steering committee just to make sure it's something that we actually want to have coalition representation at. And once we get the go ahead from them, then we bring it to the coalition and ask for people interested. Again, I'll model it with our continuum of care representative. So we brought this to the steering committee. The steering committee said they would like to have somebody represent the coalition on the continuum of care. And so now what we're going to do is take basically nominations over the next week and volunteers. Probably volunteers is better, but nominations are great too. And you can send those to info@pchomeless.org. That's the email for the coalition. And or you can send it to kind of anybody on the steering committee, but that's the best way to get it to us. Again, I'm going to put that into the chat. And once all that happens, then we bring all of that to the next coalition meeting. And it's possible that the steering committee has a recommendation. It's possible they don't. But you, and then we'll vote on it at a coalition meeting and from there forward, right? And again, we have these set of things we care about, eligibility, that aren't requirements, but things to think about, right? So we want people that are active in the coalition, that have relationships with coalition members, they have authorization to commit time to represent the coalition. And by represent, we oftentimes don't mean making decisions for the coalition, simply identifying at a meeting where something might be of interest to the coalition, bringing it back to the coalition for discussion, and then taking ideas that they glean from the coalition back, right? So it's a conduit, right? And both ways, really. Recognizing things happening at the coalition that might be of interest to another group, and a willingness, again, to report out on the items at the coalition meetings Fridays and on listserv. But all of these don't have to be in place. Courtney Chandler, who's representing us on the ad hoc committee, is somewhat new to the coalition and is an amazing addition to the team working on that, right? Great communication with all of us. So that's been a beautiful thing and doesn't meet all of our eligibility recommendations, right? So they're just recommendations. So I'd love to hear some questions or thoughts or concerns about that. I think it's been in front of you before. I actually did put a poll together. So I'm going to launch that after we have some questions. Again, just some kind of governance stuff. Our goal was not to be gatekeepers, right? Our goal was really to make sure that the whole coalition has an opportunity to be a voting part of this process. All right. I am launching the poll. Anonymous voting, so we won't know who you are. And again, yes, no, and abstention. And while we're voting, remind you that I have like 3 agenda items on today, and that's like way too many for me. So lots of opportunities to lead fun things, governance, policy things, right? You just have to raise your hand and say, I want to be, oh, Al just raised his hand. That means he wants to be more involved. Good job, Al.
No, it means I can't keep my mouth shut. I liked and voted for it, but I'm curious, does it cover a situation where we might have, say, like 4 or 5 people who are interested in being the representative and we get into a political or non-political disagreement about it?
I guess we had some good conversation around, oh, Maureen, why don't you address that?
Well, I mean, we did have that situation when we elected Courtney to represent us, and that we had, I think, 2 or 3 people who put themselves forward or who were put forward as candidates. So we might need to refine the process to somehow, if we have 10 people interested in one position, to get down. But I think that's another step that, now that you've brought it up, you can make recommendations on how we do that, please. I can see him, but he's not answering.
All right, so I've got the poll results showed. So
I didn't
this,
realize I was being asked to answer. Democracy is a messy process. And no piece of paper can cover all those options. I raised what I hoped was the most impossible option. I think we're okay.
I think you're right. We need a process for that part. So I really am looking for your recommendation because I know you think about this all the time. So.
well, you're going to have to do an amendment to this because we just voted on it. So.
Well, we will.
I don't think an amendment is needed.
All right, thanks everybody. I know governance isn't nearly as fun as other topics, but good for us to have all our expectations clear and our ways of working understood by everyone.
Garrett?
Yep.
People, please, we need to fill that slot on the continuum of care. So please think seriously about putting yourself forward or talk with someone else who would be a good representative. It's a once a month meeting, third Wednesday from usually 9 to 11. And then the expectation that you serve on a subcommittee as well of your interest. Everything's on the Pierce County Coalition, or I'm sorry, Pierce County Human Services Continuum of Care website.
So Garrett, do you want to run with the next item on the agenda?
Sure, thanks. So with the removal of Johnson & Johnson, hopefully temporarily, as a vaccine option, we're looking at more work needed to help our unsheltered and sheltered neighbors get themselves vaccinated. And the Homeless Coalition has about $20,000 in grants that we've received to support that work. Gas cards so people can get to places, support when they're there. So food, anyway, things to help draw people in to get the vaccinations and to help remind us to have discussions about vaccinations. There are a number of additional opportunities. I would love for us to get some more funding, to get some food for vaccine events, to get some more gas cards so that people can easily get to a second appointment, for phone chargers, maybe even to buy phones, so that people have a way to make the appointments that they need to get vaccinated so they don't die. So I'm asking, and so there's a couple of grant opportunities out there, and I would like, I'm asking for authorization to apply for grants specifically for COVID-19 vaccination support efforts. And all this work we are doing so thankfully with the help of the Tacoma Pierce County Health Department, who have been really amazing advocates for the special needs of our populations. So can't say enough about how pleased I am with, like, I don't think you could design better plans to help vaccinate a lot of our folks, focusing on drop-in opportunity, just lots of things that that I think are really healthy. Anyway, I would like that. So I've got another poll. Any thoughts that folks would like to have against this idea of looking for more grants? Okie doke, poll it goes. Again, authorizing me to seek additional funding to support communications, transportation, and other needs to encourage and remove barriers to vaccinations. And Kevin's been leading these efforts. I'm talk while you guys are voting. Kevin's been leading these efforts. We were able with one of the grants to extend Kevin's time, I think a month or maybe 6 weeks, in order to really support this work, because none of these things happen without, somebody, that is passionate and caring and understands how systems work. And so we're lucky that we can, that we're lucky that Kevin's willing to continue to work with the coalition in this way. All right, thank you for that approval, and hopefully that's the last you're going to hear of me in this meeting. So thanks, everybody.
That doesn't seem likely.
Nope.
So the next item on our agenda actually is coalition announcements. So this is just general coalition business that we needed to share before we move into the second half of our meeting, 11 minutes late.
I believe actually I have one more thing, which is the letter about the sheriff. I'm not quite sure how I didn't exactly get that on our agenda. So that's on me. So this one's going to take a few minutes again. As you are aware, there was an incident with a paper delivery person named Mr. Altimer, and Pierce County Sheriff Ed Troyer. In justifying his actions, the sheriff was, identifying that this individual seemed homeless, and that seemed to be a justification for escalating what was simply an individual doing their job into an armed response by the police. Hopefully you've had a chance to read the letter. I know it came out rather late last night, and I don't know how useful it's going to be to bring that letter up here, but so I'm looking for a little guidance from somebody here. Would it be good to highlight a couple things we're saying, basically, or expect people have read it and are comfortable with making a little conversation around it and then a decision?
Yeah, I would hope folks have had a chance to see it. If not, if they can just open it, know it was emailed to folks, right?
Yeah, I emailed it out, and I can throw it up in the...
Yeah, if you want to share it.
Garrett, I think the two things I would highlight are, one, it's really trying to, we started coming from the position of identifying that he had described, the sheriff described both the person and the car as looking homeless or related to that, as we wanted to address that. But then with some good input, recognize we also need to focus on the gentleman's race, and that in addition to stigmatizing homelessness, the stigmatizing of race and how that played into the event, and not wanting to lose sight of that as well.
Yeah, so we described those concerns, and I think what we end up with is that we're asking for Sheriff Troyer, Ed Troyer, to reflect on the lapse of judgment that escalated a night of work for a delivery driver into a potentially life-threatening encounter. It is your responsibility to ensure you and the officers you oversee de-escalate violence encounters, not create them. Please recognize this opportunity for further training. And we also have a line in, which is, Pierce County Council members, we support your investigation of this incident and hope that recommendations coming from it will be implemented as new policy. So those are kind of the closing statements in the letter. So any concerns with that? I got a lot of feedback. So I put a draft together that wasn't great, and I got a huge amount of feedback, and all those were incorporated into this second draft. Question from Cynthia, will this letter be shared with media? Yes, this letter will be shared with media. Note from Stephanie Schemmerhorn, this letter is strongly worded, which she likes. Thank you.
Garrett, I like the letter. I would put the Sheriff Troyer, please reflect up at the top. But the other thing is that it appears that this is a letter from you, not from the coalition. Does that need to be clarified at all?
That's a good point. Let's do that. I can't do it right now, but we'll make it clear that this is absolutely from the Homeless Coalition.
Megan, I see you have your hand up.
Thanks, Garrett, for putting this together and getting so much input. I'm always a fan of editing as a writing teacher. But I was wondering if there's any line of support for there's been the 27th and 29th Democrats, as well as Tacoma DSA, have called for like resignation and potentially recall campaign? Is there support in that? I just want to clarify. Or if not, that's okay. But I'd advocate for there be some kind of that in there.
We had some stronger language at the end, and we had a lot of comments about pulling that out. And it was messy language, so it could have been how I phrased it and not necessarily that thought. But
I just want to comment to that one of the things that I think gives this coalition some credibility is being nonpartisan. So I think it's perfectly legit to for a member of this group to ask people to join a campaign to get rid of somebody. But I think the letter just sounded more grounded and powerful without the message about, if that makes any sense.
Oh, and just to nitpick, there's an unnecessary word in the third line. It's either 2 or 4.
I like nitpicking. If that's your worst criticism of the letter L, I think you were the most concerned about making sure we put something that had everyone's thoughts in it. All right, seeing no more comments, I am going to put up my final, is this my final? No, my second to last poll of the day, which is, should we send the letter with concerns about the sheriff's interactions with Mr. Altheimer to the sheriff and county council with the minor nitpick correction and clarifying this is indeed the position of the Tacoma Pierce County Coalition to End Homelessness? And there's a few more little things in the chat. But yes, I should stop talking during polls. I was going to bring my harmonica up, but
we need background music.
That's what I'm saying. All right, I see no no's. I see a bunch of yeses. So thank you all for that. And I'm sorry we're behind, Rob.
Well, that's just the price we pay. So this gets us through our first part of today's meeting, and we are shuffling the second part of today's meeting. So Garrett and Maureen, I kind of turn to you to lead the show here while we consider breaking news.
Thank you, Rob, and thanks everybody for your indulgence on letting us add this time-sensitive request to today's meeting. So one of the things that happened out of the summits that we held was a direct relationship with Mayor Woodards. As you remember, she, in her role as mayor of the city of Tacoma, partnered with us to host both summits. And the mayor contacted me this week after the city council's study session, asking for our responses to the ordinances that were going to be presented. And this is all happening in real time, really fast, but we did receive the agenda for the Tuesday city council meeting last night about 8:30 from the city, from the mayor's policy person. And so we do have the ordinances, and we do know they're, and also the city action briefs, and the steering committee has received all this information, but I didn't put it all on the listserv until after this meeting this morning. So there, and I've had one conversation with the mayor, and we'll have another one with her either sometime today if she can fit me in, or over the weekend. So there are two ordinances that will be on the that we're talking City of Tacoma, Tuesday, April 20th, regular city council meeting. One of them is numbered 28755. And this ordinance is the update to the emergency declaration that the city has had since 2017 and which has been updated several times. And this ordinance, as far as I can, I'm going to try and stick them in the chat. And it's always wonderful if I make that happen. Aha, this is one. This is the emergency ordinance, 755. And this is what we are calling the no camping ordinance, which didn't show up, but it will in a moment, which is 756. If I can find it, there it is. Did it show up? I can't
Now
tell.
it did.
Is it? Okay. So
Yeah.
we got them both, 755 and 756. Excellent. So, and we also have the city, the briefs that the staff do. And, oh, that's
Actually, I take it back. 756 did not show up.
Okay. Let me make one more
Yeah,
try.
the action memorandum did.
Okay. Let me make one more try on 756. It just doesn't want to come today.
I can dig it out of email if needed. So.
Okay, can you? That would be great. Thank you. 756. Yeah. All right. So, okay, the caveat is I am not a lawyer, so I am not presenting any of this from a legal perspective. I have reached out to Tristia Bauman from the National Homelessness Law Center, and she has she agreed last night that she will review the second ordinance, which is the most important of the two right now for us, and get comments back. On the first ordinance, basically what happens, the emergency declaration, basically what happens is that the city adds a section that commits the city of Tacoma to engaging with, and this is really important for us, Section 3 of that first ordinance, the one that ends in 55, says that the mayor and city council declare support of Pierce County and the Tacoma Pierce County Coalition to End Homelessness in their commitment to protect public health and safety by providing everyone experiencing homelessness a safe and secure space to sleep with resources to address their health and sanitation needs by November 2021, allowing sidewalks, parks, and right-of-ways to be available for those purposes they were designed to serve. We are named in this ordinance, which I think is a huge recognition of our power, if you will, right now. And it also, the Section 4, that the city will actively participate with Pierce County's ad hoc committee in developing a regional strategy to address homelessness. And we know that they assigned Clarissa Montero as Monteros as the thank you representative. So I don't find any problems in the changes that are made to the emergency declaration. The point in time count, all that sort of stuff, that's an issue for another day. The ordinance that I believe we need to pay attention to is 28756, because this adds a new section to the Tacoma Municipal Code. And that section is given with the ordinance. So when you call up 76, we're able to get it, Rob?
I was. The issue is that the document itself is labeled as City Council Action Memorandum. So it shows up in the chat that way. When you click in it, when you click in it, it actually shows the, at least I think.
I don't know, because I had something labeled that way. Oh, I'm gonna come back in my next life with more technology expertise. Although Garrett was opposed to that. But All right, we will give this to you. You will get it.
Oh,
And the
it is
important,
there. It is there. So
it is there. Okay. So
people
when you
open
open
that-
it, you're getting it and you go
Yes.
to the back half of it, Exhibit A, and it's bringing up the city code changes in red.
Gotta see. Don't see any red.
Okay, then you're not getting it.
And I don't see it in any of the attachments that were emailed to the steering committee. I just see the memorandum. I don't see the actual legislation. There's 2 copies of 2755, but there's not 2756. And sorry, everyone, for the bumbling around here.
I'm going to try and email this directly to you, Rob.
Okay.
I've got a copy of it that's labeled. Anyway, I'll get it in there. Give me a sec.
Okay.
All right. Sorry, folks. Too many late nights and early mornings. I keep asking you for a staff, but nobody ever gives me one. So that's the real concern about this, is that it's changing city code. And in those changes, there are provisions. Not only are there definitions about what a camping means, that sort of thing, but this covers all public property. All right, all city public property. And it includes other governmental entities that have property interest, including, what do they say, easements. So we're looking at, without limitation, all parks, piers, streets, trails, forests, museums, museums, pools, beaches, open spaces, public squares, public schools, associated athletic facilities around the city, or other publicly owned or leased buildings, including not limited to parking lots and any other property in which the city or any other governmental entity has a property interest of any type. All right, that's one piece. Another piece is that the penalty for violations is $1,000. These would be misdemeanors, $1,000 and or imprisonment for not to exceed 90 days or both, for each infraction. And the third thing is that the chief of police is authorized to adopt rules, regulations, administrative policies, and procedures to implement this. So our proposal is that we have a discussion now, not breakout, but a discussion that's pretty carefully scripted. And fortunately, we have those new norms. And that we, the coalition, by the end of today's meeting, we will have authority to send a letter to the city council, the mayor, the city staff, and Garrett's drafted a letter for us that we'll take a look at, and that this will be our beginning point of negotiation. We want this ordinance pulled. Its first reading is April 20th. We want it pulled until the city meets a list of criteria that we are enumerating. And the way we'd like to do this morning now is everybody gets one chance to talk out loud before anybody gets 2 chances. All right? Everybody gets 1 before anybody gets 2. But you can use the chat to your heart's content. We save it. We look at it. Jeffrey is going to watch this morning's chat to make sure that we don't inadvertently miss anything, and that you are not representing your agency unless you declare that. But otherwise, these are your comments, your thoughts, your questions, your positions. We will not identify you publicly with any of these statements without going back to you and asking for your permission. So this is as close to anonymous as we can make this right now. Some of us in the steering committee did respond to Garrett's initial draft. Some of us did meet this morning at 8 o'clock. And so that's where we are. The best we can do between about 8:30 last night and 8:30 this morning, and including an email from Garrett at 2:15 this morning. So please, your what works best? Do you want to bring up the actual? Okay, here's our letter. Or these are our points, which will be included in our letter. The actions that we request the city of Tacoma complete before they do any action on this ordinance, this no camping ordinance, that they simply pull it from the agenda until they establish appropriate, accessible, available safe sites for all prior to changes to the city code around the use of public property. That they work with Pierce County Human Services and the coalition, and we'll spell ourselves out to determine the unsheltered count in Pierce County and the shelter bed availability to understand the scope of shelter needs. Current need is estimated by the county at 1,350 people living unsheltered. This was presented to the ad hoc committee Wednesday. And the coalition counts just 40 shelter beds currently available as of Monday morning. 3, that the city lead a citywide public process with significant community input to establish how to best use public property to provide spaces for the activities of daily living for individuals living unsheltered. This is a reference back to Martin v. Boise. That Pierce County, no, this should be the city, Garrett. Oh, no, I'm sorry. This is right. That the city will pull this ordinance until the county has created and adopted the comprehensive countywide plan to end homelessness, and that the city has adopted neighborhood and community services 5-year homeless strategy, which they are currently working on. And then we're just starting to list off some talking points that people might want to use or that we might incorporate in the final level, like the fact that we're trying to establish safe sites for all aligns with the city's commitment and their anti-racist efforts, because we know the disproportionality of people of color in our population of people who are experiencing homelessness. And that Safe Sites for All is an anti-violence activity. And the 2 recent homicides in Tacoma were a product of inadequate shelter. If you remember, people who were housed came out of their houses and killed people who were homeless, one living in a tent and one living in a van, or appearing to live in a van. So, so please, floor is open. And I can't both see who wants to talk and what's on the screen.
So Rosemary has her hand up.
Oh, I see that. Okay, Rosemary, please.
So the hand up maybe works. I hope that does.
Yeah, I can see it.
I really like this. I was thinking the only thing where you say that they delay the ordinance until these things happened. I think we would maybe want to say delay consideration of the ordinance, because I don't support the ordinance as it is in any way. So that would be my only suggestion.
Oh, good. Thank you. Okay, let me look for some more hands. Come on, folks. Got to get your hand up.
I see Teresa's hand and Megan's hand.
Thank
So
you.
Teresa
Teresa?
first.
Yeah. Oh, thanks.
So
Rob.
I was just trying to make space like we talked about, but since there's space, I'll say I'm really glad to see you adding that about the incarceration and fines, because, and maybe even say really clearly in there that people who are camping on public grounds are, I mean, clearly they're not wealthy. So finding them money is a I mean, it's a crazy idea. Somehow I'd like it to be in there that it's really crazy. And incarcerating them is also crazy. So thank you for adding that.
Thank you. Megan?
Yeah, I would advocate for this being pulled from the agenda. That should be the ask. We weren't consulted around this before it was put, especially after an ordinance that really names and highlights our work and the work that the coalition's been doing. I would also name and add a change, right? So this is an email. Seems out of line with the anti-racism systems transformation resolution that was passed over the summer, that's been quoted and highlighted so many times, completely out of line, especially giving more power to the chief of police, putting folks experiencing homelessness who are disproportionately folks of color in harm's way of the police is not okay. Yeah, I'm really upset by this. And yeah, I think the coalition's best move is to ask for this to be pulled at this moment, and then we can have a conversation.
And we lead with that, Megan. But we qualify that, you know, we'll have the conversation when all of these things happen.
Yeah.
Obviously, we can have interim conversations if they're open to it, but we don't want to see this ordinance until at least this list of demands is met.
Yeah, I would just say it's out of line with that res. I think naming that is.
You're fading in and out, Megan.
Oh, sorry. I think naming how it's out of line with the anti-racism systems resolution is really important.
Yeah, yeah. Okay, other hands?
I see Al has his hand up.
Two things. Number one, this ordinance seems to directly contradict the high sounding policy ordinance, the other ordinance. And number two, are there bills being passed in the state legislature that would make some of these proposals illegal?
On the second one, unless there's something under an anti-racist, I don't know if Cynthia's still on the call. She might have a better, clearer answer. I can't think of anything because 1220 affects planning for shelters and transitional housing and things in all those jurisdictions. And also well, actually, this could fall under 1220 because if 1220 passes, so these are all the jurisdictions that plan under the Growth Management Act. Yeah. And the part of what they have to do is review their existing racist and discriminatory policies. Yeah. And so if that passed, this might fall under that. A review of the policy might fall under it. Yeah. There's precedent. City of Everett recently did a no camping ordinance. I'm sure there are others around. Other people, please. They don't even have to be complete sentences, just bullets in the chat or out loud thoughts. Going once? Going twice? Let me just check the chat here. Oh, is there a sense of how much support there's for council? You know, I'm not sure there's all that much support because this started as a council member request, and it was from Tom's, council member Tom's, and it had to be signed off by two others, and the mayor and Deputy Mayor Blocker were the two people who signed off, and I don't see anybody else listed on the ordinance. So I'm not sure that there's that much support.
Can I jump in for a second, Marie?
Please, yeah, please do.
There are two, I call them false narratives, that city staff have perpetuated over the years. One of them is that there is adequate shelter in the community. And the second one, which is basically mated to that one, is that people are refusing services, and so they're not picking that. So this narrative has come across in many ways over the years, very directly. Again, there is adequate shelter, people are choosing not to take it. And so some of the council members have heard that so many times that they believe it's true, and that the barrier isn't creating more shelter, that the barrier are the people that are homeless, unwilling to go in shelter because of mystery reason X. And so I think educating the council on how untrue that is really challenging, and that this type of ordinance is a product of that continued misinformation. That's my theory. It's not exactly fact-based, but yeah.
And I think the council, at least some of the council members, it's clear they want to be educated. They're signing on for national webinars around use of FEMA for hotel and motel rooms. The mayor was not familiar with Built for Zero. While I was talking with her yesterday, I guess, about Built, she was talking in phases. People had to do this and then that. And I said, no. I said, we're using Built for Zero. And she was on the website as I was explaining it to her. And she's looked at the cities where Built for Zero is in place. And she said, I know these mayors. And so she said, I'm going to call them and talk to them. So I think there's an honest desire to do the right thing, at least by some of the members. And so maybe what we're doing is we're helping them do the right thing.
There's a question from Al. Do you have any data to refute that false narrative? Yes, we do. The county just published data about the number of people homeless. That's why we included that in that phrase, 1350. I think the number is higher, but it doesn't matter how much higher. And the number of shelter beds is, I think I'm the only one that really knows that. And the county has put out some incorrect information, like factually correct, but realistically incorrect on the number of shelter beds. So those are pretty solid. I don't think they're refutable. Like, I don't understand.
We also have the project out of Seattle, Just Cares. It's 100 people moved from encampments into hotel rooms. This is different from congregating the shelters, DESC and CCS's shelters. These are folks who were living in encampments who moved into hotel rooms. And that's a University of Washington reviewed project, that sort of thing, engaged project. What else, folks? Has everybody who wanted to talk out loud one time had a chance? If so, we'll take a couple people who already spoke if you want to speak again.
I raised my hand, but I don't know that anybody can see it. One thing that I saw James comment that it is fact-based, so I kind of just wanted to see if he wanted to share what's behind that, just for so that we're aware.
Oh goodness, you have to remind me what that reference was to. That was Garrett saying something along the theory of why he believes that the ordinance, the narratives you're referring to, right, about that people are refusing. And I was just saying that in 2017, there was a declaration of emergency in the city of Tacoma that included two portions. And I sat with Councilman Tom specifically at that time, as well as other city members, but Councilman Tom's was right there stating exactly that there was, we need the ordinance to include sanctioned campsites, and they made one, the stability site eventually became that. It started off as a mitigation site down on the river. But the other part was, and we need to force them there. And like the narrative that Garrett shared is, we believe that people need to be, enforced to go. And I was just saying that it's fact-based that Garrett has that belief, because I've heard it right from Councilman Tom's mouth 4 years ago, almost to the day. It was May 9th, 2017, that I sat in the room at the city and heard him say that. And there was the staffers there in what now has become NCS reinforcing that, yeah, that sounds right. There's plenty of people who are going to refuse it unless we make it. And I was just like, oh goodness. And during that whole time, we kept saying that we don't need to force anyone to go anywhere. They're coming more than we have capacity to serve. And then the day that we moved to the stability site that Catholic Community Services ran, there was people saying they would never go there. It's a concentration camp and everything. And everybody went there. Every single person that was allowed to go there. There were some folks that CCS was unable to serve, or they were not willing to follow the guidelines of the new program, but every single person took it. Another example, in 2019 at People's Park, part of those meetings was the same conversation, and it didn't have the enforcement piece, but the same thing. They opened up 38 slots at tiny homes, and we had 84 people at People's Park who wanted them. And we'll never know what people will or won't take until we've run out of options to offer them. But we always offer one solution for 80 people, and it's full every single time. So that's what I was referring to, the fact-based. It's just that I know the narrative has been said to me. And again, I can also reference conversations in Puyallup as well, when I was contracted in Puyallup, that there was a belief that the people needed to be kind of enforced into these situations. So I think that's what I was referring to when I wrote it.
Thanks, James.
Yeah.
And I see Jeffrey has his hand up.
I'm not sure if I have all the answers. No, I don't think anybody does, but in conversations I've had with many of the homeless, they feel that going to a shelter, congregate shelter, is a step down from being in a tent in the city, and that they do not feel that it's a viable option when the city says, well, you need to go here. And so that, I think that's something that we really do need to keep in mind and try to educate the city in that regards. Part of my understanding of Martin versus Boise is that they specifically stated a shelter had to be available. I haven't seen some of the other cases based on that yet, nor am I an attorney. But we do need to think in terms of what are the rights of these individuals? They all have civil rights the same as the rest of us. And forcing somebody to do something seems to go against that very thing. So I think we need to keep that in forefront of our minds as we move forward here, that these are our neighbors. They are individuals and they are citizens of this country, most are, and that we need to maintain their rights as human beings, as citizens of this country. So that's my 2 cents.
Thank you. Anybody else? I mean, clearly we have a lot more work to do to try and flesh out the points that have been brought forward. Oh, I see. Okay, we're in. You get to talk twice right now. So, James, go ahead.
Yeah, I can wait. I just want to make a point of clarification that the Martin v. Boise actually changed not available, but accessible. And that means a lot of things, but it also means somebody who has faith beliefs that don't align with the shelter's faith community, that is no longer accessible to that person, even though the shelter might be available. If the person has a pet and the pet is not allowed, that shelter is no longer accessible, even though it's available. So Martin v. Boise actually changed just one little word from another court case that happened in California that actually did include preferential kind of expectations of a person accessing these places. So even more so, it's not just like we can have a million faith communities because there's somebody out there who can't access a faith community to get their shelter needs met.
Thank you. Thank you. And one of the points Tristia Bauman made early on was that Martin v. Boise, like other laws, other federal laws, will continue to be interpreted as court cases come forward. The only one I know of is Grants Pass, but there may well be some others by now. So if we can wrap this part up, Garrett and I and the members of the steering committee who were able to read fast enough, were up late enough or early enough, excuse me, is that we really want the approval of you all to allow us to prepare a letter based on what we've presented and incorporating whatever appears to fit with this particular letter to present to the city council, the mayor, and the staff by the end of the day today. And I know that's asking a lot. So here's the poll. Should the coalition take the stated position on camping enforcement and authorize Maureen Howard to submit a letter to the Tacoma City stating this position? On the other hand, unlike the summits, at least I didn't make the decision first and then ask for support.
I'm going to take advantage of my second opportunity here. I would just encourage everybody who's participating today as individuals to talk to city council people yourself and express how appalling that second ordinance, proposed ordinance is, especially given the first proposed ordinance.
All right, folks, thank you. It's either yes, 89%, or abstentions. And those are generally the government people, not always, but often. So thank you. Thanks for your trust. Thanks for your work. Thanks for your willingness for us to upend the agenda. So, and the final letter will go out by hopefully by 5, and it will go to the listserv as well after it goes out. Thank you.
Thank you, Maureen and Garrett and everybody for participating. So as you can see, we only have a few minutes left in today's scheduled meeting time. However, I do want to switch over to government updates if there are folks who would normally provide an update to us and are still with us today to fill these last 5 minutes. So Clarissa, do you have anything to update from the city of Tacoma?
I do. Hello, everybody. Good morning. And before I start my update, I just want to say it was such a pleasure to hear you guys go through that process. And I second what Al said. Our council needs to hear from everybody, including you guys. So yeah, thank you for that. That was great. On to the updates. The temporary hygiene station at 8th and Yakima will be extended for 90 more days. Council authorized 2 additional locations for temporary hygiene stations at 705 and at A Street. Site design is underway and ideas are welcome. Council approved moving forward with site design for 2 mitigation sites. We do hear your concerns about it being far from services. They are. Again, if you feel inclined to contact your representatives, please let them know. Thank you, Colin and Kevin, for your great work with communities to locate safe parking in neighborhoods. We would love to learn more about how you engaged with the neighborhoods to support the location. Also, staff presented at council for options on the temporary mitigation site during the study session on April 13th, and we're updating again on the 27th. I'm gonna put the link of the study session agenda in the chat for you guys while I'm speaking to you, if I can. There you go. And also, the rental assistance portal is still open and moving along. We believe the bugs have been worked out. And I'm also putting a link to the temporary shelter census in the chat for you guys. Thank you all. Happy Friday.
Thank you, Clarissa. And before we run out of time, Valerie.
Hi. So yeah, rental assistance is up and running. We have 7,371 applications received so far. All 8 of our providers, 9 of our providers, because 1 is funded with City of Tacoma, and the other 8 are Pierce County. So 7,371 rents are being cut, utilities are being paid, all the things are happening. I have an example of the portal that will go live, so I'm happy to share that if you want to see it. I can't send you a link. I was going to kind of give you a quick snapshot on my screen, but I don't know if it will let me. So nope, I can't. That's okay. We'll do it next week, Rob. We'll do it next week. And so
I just
that way
made
you
you
can see
co-host
what
if you want to try. So.
Oh, okay, let me try. Screen 2. Okay, so this is the draft. So we're gonna make some changes we see. So can you see my screen? Yes, okay, great. So you'll see on here, you have number of applicants, 7,371. We're gonna track how the applications are coming in. You'll be able to see each month how many have received since the opening day, which was March 1st. Number of seniors, so 16 up as requested by City of Tacoma staff, 779 households are seniors, and then we're going to track that as they come in, and 158 households have identified themselves as veterans. These are all applicants received. Then we're going to break it down by gender. Female, male, client refused, non-conforming, trans female, trans male, client doesn't know, so that we can really just track and make sure. So as you scroll over each of them, you'll be able to see the exact number. So like 33 households have identified as gender non-conforming. And then when you go down some more, applicants by age. So this is the primary head of households, folks in the household, so that we can just really track. And 393 are unknown. We're working with that to make sure, because date of birth is a required field. And so that will be updated. And then you get into location. See, folks got a little excited and applied outside of Tacoma and Pierce County, but this is going to really help us figure out, are we doing a good job of outreach? Where are we missing some folks? And so you can see like 12 people from all the way out over in Carbonado, 2 down from Ashford. Yes, Ashford is in Pierce County, and then folks all over. So we are just really tracking this information very closely, and we're going to go through and clean up all of these ones who have applied outside Pierce County. Other programs are now finally open, so they'll be able to apply for their programs instead of ours. And then you'll get down to race. So pretty high number of Native Hawaiian Pacific Islanders. So that number, I'm still not convinced it's accurate. So we're working through all of that and cleaning up the data. And then you have 24% white, 21% Asian, 15% Black African American, multiracial, which they get to select. Client doesn't know, client refuses, because that is always their option. And then American Indian Native Hawaiian. So we are also going to add on here, I'm going to do stop sharing real quick. We are also going to add on here payments. So as payments are being made, thank you, Teresa. So as payments are being made, that's going to be tracked as well. So what households applied, what households have received payment, and then that information will be broken down by race demographic as well, so that we can ensure we are being equitable across all providers and across the system. So more to come. Wanted to give you a quick little snapshot just to let you know we are still working on it. That's all. So we are tracking by households. If there's going to be a chart on here that's individuals, Maureen, then we will let you know what that looks like. But each household enters the name and birth date of everyone in the household, so that we can track if we're serving large households or if we're serving a lot of single households. So right now we're going to be doing a lot by household, not by individual, just because when the rents and utilities portion is updated, it will be by household. And no, these are just submitted applications. So there are some that are completed, rents have been paid. I know of a landlord that received a $28,000 check in just past due rents last week. And so as soon as that portion is updated with the payments, you will see that added to this as well. So this will go live. It will be open for anyone to see at any time, and it will be updated once a week. And that's all I have, Rob.
Thank you, Valerie.
You're welcome.
And I know that we didn't have anybody from the Tacoma Pierce County Health Department who could join us today. We could encourage Michael maybe to provide his update in email. He did reach out to both Garrett and I with some updated information, and I can paste some of it into the chat as well. So we are now at 11:01. I really appreciate everybody's patience with today's meeting. I want to publicly thank Tegan from the city. She was prepared to present today, but we had other things to deal with. So I appreciate her understanding, and she will be back next week to hold the discussion about the city's mental health and substance use disorder, and how that implicates, how that weighs against the homelessness plan that the city's creating. So we will have that conversation. It'll just be next week. So I wish everybody a safe and happy weekend. If you want to stay on the call, we will have a small group of us doing planning for next week's meeting. But if you can't stay with us, thanks very much for your participation today, and we'll see everybody next week.